Hello students, my name is Jean Kita, M Pharmacy Assistant Professor, Department of Pharmaceutical Chemistry. I will deal the Medicinal Chemistry 2 for B Pharmacy 3rd year's first semester. So today we are going to discuss the topic is thyroid and antithyroid. It is the fourth unit. So in this we will discuss the introductions, what is the thyroid and what is the antithyroid drugs and what is the thyroid gland and where it is located and what are its functions, biosynthesis and what are the types of the thyroid diseases and what are the thyroid drugs we are using and what are the antithyroid drugs we are using, mechanism of action, structure, adverse drug reactions and uses. So before discussing about the thyroid and antithyroid drugs, let's discuss what is a thyroid gland. So thyroid gland, it is located in our body and it is one of the largest and highly vesic- vesicularized endocrine gland which is present in our body. So it is mainly made up of the functional units like follicles. So these follicles contain the cavity called follicle lumen and it is mainly filled with the gelatinous colloid and it is surrounded by the single layer called epithelial cells. And the glycoprotein is known as thyroglobulin and it is the high molecular weight. So it is a protein with high molecular weight that binds to the iodine with present in the organic form. So upon hydrolysis, this thyroglobulin will release the thyroid gland. So from the thyroglobulin only the thyroid gland will get released. When the thyroglobulin undergoes the hydrolysis process, means in presence of the water, it will releases the thyroid gland and which considered to be the ionated tyrosine derivative. They are considered from the L-tyrosine. So the thyroid gland is mainly controlled and maintained by the pituitary gland. So the master gland is known as the pituitary gland. So not only the thyroid gland but also the whatever the glands are present in our body, but all glands are controlled by the pituitary gland. So this pituitary gland is also known as master gland and it is controlled not only by the pituitary gland but also by the hypothalamus which is located in the brain. And these glands will secrete the three hormones, that is thyroxine is T4 and triiodothyronine is T3 and calcitonin. So these are the three hormones it will secrete, that is T3, T4 and calcitonin. So the thyroid hormones, the T3 and the T4 are the non-steroidal in nature and chemical regarded as the amino acid which contains the iodine diphenyl estrus. So the thyroxine is also known as T4. It is a major form of the thyroid hormone which is found in the circulation. And the ratio of the thyroxine T4 to the triiodothyronine T3 releases in the blood circulation is 20:1. So the ratio is between the T4 and the T3 is 20:1, means the T4 is the 20 and T3 is the 1 ratio. So it is 20:1 ratio. And the thyroid glands also secretes the calcitonin that is responsible for maintaining the calcium hemostasis in our body. And the calcitonin is produced by the parafollicular cells of the thyroid gland. So this calcitonin is also released from the thyroid glands along with the T3 and the T4 hormones. So see here, this is the normal thyroid gland. So this is the thyroid gland. See, this is the normal condition. But in the hypothyroidism, here the enlarged of the thyroid gland we can see. See here the enlargement of the thyroid gland. But in case of hyperthyroidism, the thyroid gland does not undergoes the enlarged. But when we compare with the normal thyroid it is very thin in hyperthyroidism. See, means the thyroid problems are two types, that is hypothyroidism and hypothyroidism. If you see in the hypothyroidism, the thyroid gland will get enlarged, but not in the hyperthyroidism. But in hypothyroidism will get due to because the it cannot able to release the hormone. But in case of the hyperthyroidism, what will happen is excess amount of the hormones will get released to cause the hyperthyroidism. So see what is the biosynthesis. First starting step is plasma iodine. Upon the trapping of the iodine, it gets converted into the oxidation of the iodine. Here, when it undergoes the ionization of the tyrosine to Tg to form MIT and DIT, it gets converted into the MIT and DIT. So upon coupling to form T3 and the T4 hormones, it gets stored in the Tg, and this T3 and the T4 will get stored in the blood, and then it reaches the periphery system. Then it undergoes the de-iodization. So this is the biosynthesis of the thyroid gland, that is plasma iodine. Upon the tapping of the iodine, it gets converted into the oxidation of the iodine, and upon the iodization of tyrosine in Tg to form MIT and DIT, it leads to coupling to form the T3 and T4. It gets stored and transferred to the blood, and then it is transferred to the periphery, and then it gets deionization. So this is the biosynthesis. Next, what is the mechanism of action? So thyroid hormones will diffuse with the cell membrane and binded into the intracellular thyroid receptor. So these hormones will get bind to the thyroid receptor. So after it get penetrated into the cell, the T4 get converted into the T3. So which are affinity for the thyroid receptor. So T4 is converted to the T3, and this T3 will binds to the receptors, and they undergo the change in the conformation, which stimulates the transcription resulted in the synthesis of the proteins which produce the T3 and the T4 action. So here mechanism of action is nothing but thyroid hormones will diffuse across the cell membrane, and it will bind to the thyroid receptor. So the hormones will be binded to the thyroid receptors. Here what will happen? The T4 is converted to the T3. So here what it will do is it is responsible to synthesis of the proteins which are produces the T3 and the T4 action. So pharmacokinetics are T3 and T4 are well observed orally. The T3 get distributed in the all organs, while T4 is concentrated on mainly in liver and kidneys. Means T3 can distribute it all over the body for all the parts, but T4 is only in liver and the kidneys. And most of the circulating T3 and the T4 are binded to the three proteins, main proteins, namely thyroxine binding globulin, thyroxine binding prealbumin and albumin. These are the three proteins for which the T3 and the T4 get attached. Namely, that is thyroxine binding globulin and thyroxine binding prealbumin and albumin. And about 75% of the T3 and the T4 will bind to the thyroxine binding globulin. So TBG is nothing but thyroxine binding globulin, and only minimum amount of the hormone is available for action, metabolism and elimination. So this T3 and T4 is mainly get metabolized in the liver by deionization and sulfate conjugation, and it is excreted through the bile and urine. Here pharmacokinetics, it is oral route of administration. And the T3 is it will spread to all over the body, but T4 is only concentrated in the liver and the kidneys. So it is mainly bind to the three proteins, namely thyroxine binding globulin, thyroxine binding prealbumin, and albumin. So the 75% of the T3 and the T4 will be bound to the thyroxine binding globulin, and remaining amount is free and it undergoes a metabolism and elimination process. So it is mainly metabolized in the liver by using the deionization, sulfate conjugation. It is excreted in bile and urine. So this is the pharmacokinetics. Next, adverse drug reactions are diarrhea, headache, weight loss, palpitation means irregular heart rate, tremors, irritability, heart intolerance, and they occasionally cause the anginal pain in the patients with ischemic heart disease, and also they precipitate the hypoadrenal crisis in the patients those who are suffering from the hypocortisolism and hyperthyroidism. To avoid, the patients are retreated with glucocorticoids. Next, uses it is thyroxine is preferred over T3. Means thyroxine is the T4. So T4 is more preferable than the T3 because of the excellent oral bioavailability and the longer plasma life, due to which single daily dose is possible. Means only the single dose is enough for a day, and lower incidence of the angina and congestive heart failure. Means it does not the problems in angina and the congestive heart failure will be reduces when we compare with the T3. And thyroid hormones are mainly used as replacement theory, like adult hypothyroidism, non-toxic goiter, and thyroid carcinoma, coma, hypothyroidism. So for this replacement, this has been used. So what is the difference between the T3 and the T4? So T3 is the quicker onset of action for 6 to 8 hours, but it is the delayed onset of action for 6 to 8 hours, and it is a shorter plasma life, it is the longer plasma life, it is effective in smaller dose. Means if you use a smaller doses also it is enough for the T3, but it is only that if you use the higher doses only the T4 is effective, and it is less tightly bound to the plasma proteins. It is more tightly binded to the plasma proteins, and it is lightly bonded to the tightly bonded to the nuclear receptors, and it is less bonded to the nuclear receptor. So this is the difference between the T3 and the T4 hormones. So, thyroid diseases are of two types, that is hypothyroidism and hyperthyroidism. So, if you see here in the hypothyroidism, what will happen is the thyroid gland does not produce enough thyroid hormones to meet the needs of the body. So, it does not produce the required amount of the thyroid hormone for the body. Here, because the thyroid gland is inactive in nature, here what will happen? It will produce excess amount of the thyroid that more than our body required. Hypo means it does not release any of the thyroid hormones. Hyper means it will releases the more than what we required of the hormones. So what are the symptoms here? Fatigue, weight loss, and low heart rate, muscle pain, cramps, weakness, insomnia, and respiratory tract infections, depression, etc. So these are all the symptoms we can see in the hypothyroidism. But in case of the hyperthyroidism, agitation, restlessness, weight loss, tremors, and allow increased appetite means increased of the hungry, rapid heart rate, sweating, nervousness, and skin thinning. So this is the difference between the hypothyroidism and hyperthyroidism. So hypo means not releasing of the thyroid hormones. Hyper means releasing of the the thyroid hormone more than what we require. So both are dangerous. Means if the thyroid glands releases less means is also dangerous, more means is also dangerous. So let's see what are the thyroid drugs. So thyroid drugs are used to correct the hypothyroidism. See, the hypothyroidism means not releasing of the thyroid hormone in our body. So in order to correct the hypothyroidism condition, the thyroid drugs we are using. So various drugs are using like levothyroxine is also known as L-thyroxine. Levothyronine is also known as L-thyronine, Leotrix. So these are the drugs we are used as a thyroid drugs in order to treat the hypothyroidism. So mechanism of action, the thyroid hormones, it will diffuses into the cell membrane and it will bind to the thyroid receptors. So here the T4 is converted into the T3, and here the T3 it will bind to the receptors and undergoes the changes which results in the synthesis of the protein which produces the T3 and the T4 action. So here the thyroid hormones will diffuse to the thyroid gland and the T4 get converted into the T3. The T3 will results in the synthesis of the proteins which produce the T3 and the T4 action. So this is the mechanism of action of the thyroid drugs. Adverse drug reactions are diarrhea, headache, weight loss, palpitation, irritability, heart intolerance, and also this also causes the anginal pain. The patients those who are suffering from the ischemic heart disease, and also it will precipitate the hypoadrenal crisis in the patient those who are suffering from the hyperthyroidism. So hence to avoid these patients are retreated with glucocorticoids. So uses, it means the T4 is more useful than the T3 because of the excellent oral bioavailability and as it has the longer plasma life. So single dose is required and also it is not more dangerous the patients of the angina and congestive heart failures, and also it is used for the various replacement therapy that is hypothyroidism, thyroid nodule, thyroid carcinoma, non-toxic goiter and coma. So for this we can able to use this thyroid drugs. So in thyroid drugs the first drug is L-thyroxine is also known as levothyroxine. In IUPAC name is 2-amino 3,4,4 hydroxy 3,5 diiodophenoxy 3,5 diiodophenoxy propionic acid. IUPAC name is 2-amino 3,4,4 hydroxy 3,5 diiodophenoxy 3,5 diiodophenoxy propionic acid. So this is a structure. If you see here, this is a propane 1, 2, 3. So this is the propionic acid. In the second position, amino group is there, and here in the third position, a phenyl group is there. So for the phenyl, in the third position and the fifth position, iodine is there, and here in the fourth position, oxygen is there, and here another phenyl group. For this phenyl group, in fourth position, hydroxy, and in third and fifth position, iodine group is there. So it is 2-amino 3, 4, here 4, hydroxy, 3,5 diiodophenoxy, and here 3,5 diiodophenyl, and this is a propionic acid. So this is a structure and IUPAC name, and properties are it is the solid crystalline in nature, it is slightly soluble in water and insoluble in ethanol and benzene. Next, pharmacokinetics, it is oral route and intravenous route of administration. So the food will interferes with the absorption. So this drug should be taken with an empty stomach before taking of the food for the better absorption, and it is metabolized in the liver, kidneys, brain and muscle, and it is eliminated through the urine and feces. Here, oral route and intravenous route of administration. This drug should be taken with an empty stomach. Means before taking up the food, this drug should be taken for the better absorption. It is metabolized in the liver, kidneys, brain, muscles, and it is eliminated through the urine and the feces. Adverse drug reactions are increased appetite means increase of the hungry, weight loss, heat sensitivity, sweating, headache, hyperactivity, nervousness, anxiety, tremors, mood swings, and sleeping in trouble sleeping, tiredness, muscle weakness, changes in the menstrual period for female, hair loss, diarrhea, vomiting, and stomach cramps. So these are the adverse drug reactions. So uses, it is used to treat the hypothyroidism. This condition when the thyroid gland produces two very less thyroid hormone. So this is used to treat the hypothyroidism when the thyroid gland will releases a less amount. Means whatever the amount that of the thyroid gland means whatever the required amount of the thyroid hormone is required for our body, it does not release it. For that condition, this drug has been used, and also it is used to treat the goiter, means enlargement of the thyroid glands, and also treat the thyroid cancer. Next drug is L-thyronine, is also known as levothyronine. This is the structure, and IUPAC name is 2-amino 3,4,4 hydroxy phenoxy phenyl propionic acid. IUPAC name is 2-amino 3,4,4 hydroxy phenoxy phenyl propionic acid. See here structure. This is a propionic acid. How many carbon atoms are there? 1, 2, 3. 3 carbon atoms means propyl. Propyl in second position, amino group is there. So 2-amino 3. In third position, this phenyl is there. And here again in fourth position, the 4-hydroxyphenoxy is there. See here, this is the structure of the phenyl. In the fourth position, hydroxy is there, and here one of the oxygen is there. So it is the 4-hydroxy, and this is a phenoxy. So the IUPAC, according to the IUPAC name, here 2-amino 4,4-hydroxy phenoxy phenyl propionic acid. So this is the structure and IUPAC name. And the properties side, it is a solid crystalline in nature, and it is soluble in water, insoluble in ethanol and benzene. So pharmacokinetics, it is oral and intravenous route of administration. In the liver, this drug is involved in a number of biochemical reactions, including the protein synthesis, oxidative catabolic reaction, but it is not metabolized in the liver. It is distributed via systemic circulation to the various parts of the body, and it is eliminated through the urine and the feces. So it is the oral and intravenous route of administration. In the liver, it undergoes many biochemical reactions, means including the protein synthesis and oxidative catabolic reaction, but it does not metabolize in the liver, and it is distributed to various parts of the body through systemic circulation, and it is eliminated through the urine and the feces. Adverse drug reactions are stomach pain, nausea, headache, loss of weight, diarrhea, anxiety, and sweating. So uses, it is used to treat the hypothyroidism and also the like thyroid cancers and make edema condition. So it is used to treat the hyperthyroidism and also the thyroid cancer. So these are the two drugs which comes under the thyroid drugs. Means these two drugs is used to correct the hypothyroidism condition. Next, what is antithyroid drugs? Let's see what is the antithyroid drugs. So the antithyroid condition is what it will release the excessive amount of the thyroid hormone that more than what we require. So it is also dangerous. It will cause some of the problems. So in order to avoid it, we are using the antithyroid drugs in order to suppress the hyperactive thyroid glands and also to reduce the production of the T3 and the T4 in the thyroid gland. So the Graves' disease is an autoimmune disorder which is characterized by production of the thyroid stimulating immunoglobulin. The antibodies produce TSH-like effect but are not regulated by the negative feedback mechanism. As a result, the TSH is produced in the excessive amount to produce T3 and the T4. Enlarged thyroid gland and exothalamus are its characteristic sign. So, here what will happen regarding the hyperthyroidism means it will release the more amount of the thyroid hormone more than we require. So it is dangerous. In order to avoid the antithyroid drugs we are using in order to suppress the hyperactive thyroid gland and reduce the production of the T3 and the T4 present in the thyroid gland. So classification of thioamides, example polythiouracil, carbimazole and methimazole. Next iodides, potassium iodide solution and Lugol's iodine. Next radioactive iodine I-31 and ionic inhibitors perchlorides, thiocyanates and nitrates. Next ionated contrast media oral iodate. Ionic acid. Next, inhibitors of the hormone release iodine of potassium, sodium, organic iodide. So these are the drugs which comes under the antithyroid drugs. They are thioamines, that is polythiouracil, carbimazole and methimazole. Next, iodides, that is potassium iodide solution and Lugol's iodine. Radioactive iodine is I-31. Ionic inhibitors, that is perchlorides, thiocyanates and nitrates. Ionated contrast media, that is oral iodate, ionic acid. And inhibitors of the hormone release, that is iodides of potassium, sodium and organic iodides. So these are the drugs which comes under the antithyroid drugs. So let's see what is thiamides. So its mechanism is these drugs will bind to the thyroid peroxide and prevent the oxidation of the iodine, which in turn causes the inhibition of the ionization of thyroxine residues in thyroglobulin coupling of the iodothyrosine to produce the thyroid hormone. So its main mechanism is it will bind to the gland and it will inhibit the releasing of the thyroid hormones. So its main function is to reduce the thyroid hormone. In addition to this, the polythiouracil also inhibit the conversion of T4 to T3. So its main mechanism is to inhibit the release of the thyroid hormones and also to inhibit the conversion of the T4 hormone to T3. So next pharmacokinetics, it is the oral route of administration and it is well get distributed in the body and it is metabolized in the liver and excreted in urine. So adverse drug reactions are over treatment with thiamines can cause the reversible hypothyroidism. Means if you use the more with more dosage means what will happen? This drug is used in the treatment of the hyperthyroidism. If we use the more dose what we require means it can convert it into the hypothyroidism. Means the thyroid glands may can't able to produce the thyroid hormones what we require. And also the gastrointestinal problems, joint pain, skin rashes, hair loss, fever, liver damage, agranulocytosis. Uses it is used to control the thyroid toxicosis and seen in the Graves' disease, and it is also used in the treatment of the hyperthyroidism. Means carbamazole is given in the inpatients with florid hypothyroidism and substrenal coitus to reduce to retender them. And also the ender patients, those who are treated with the those who are treated with internally treated with the antithyroid glands, which are then gradually withdrawn them response to the development. Nothing but here this drug is used to reduce the release of the thyroid hormones in the body for the treatment of the hyperthyroidism. So in this first drug is propyl thiouracil. Propyl thiouracil drug name. So this is the structure. IUPAC name is 6-propyl 2-sulfylidine 1, 2, 3, 4 tetrahydropyrimidine 4 ohm. IUPAC name is 6-propyl 2-sulfanidyl 1, 2, 3, 4 tetrahydropyrimidine 4 ohm. So this is the structure of the pyrimidine. In fourth position oxygen is there. In the second position sulfur, and in the sixth position propyl is there. Means 1, 2, 3. 3 carbon atoms means propyl. So it is 6, 1, 2, 3. So 6 propyl, 2 sulfanidyl. This is the pyrimidine 4 ohm. So this is the structure and IUPAC name. And properties are it is a white crystalline powder, bitter taste, and it is insoluble in ether, chloroform, benzene. But it is freely soluble in aqueous solution of ammonium alkali hydroxides. Next, pharmacokinetics. It is a oral route of administration and it is metabolized in the liver and it is really metabolized in the liver and it is excreted through the urine. So here it is oral route and it is metabolized in the liver and it is excreted through the urine. Adverse drug reactions are stomach upset, headache, nausea, vomiting, rashes, itching, dizziness, spinning sensation, joint pain, muscle pain, decreased sense of taste, hair loss, change in the amount of urine output. Next uses, it is used to treat the hyperthyroidism and it is also works by stopping the thyroid glands from making the too much thyroid hormone. But this dose is not used for the children, only for the adults, only we have to use this drug. So it is used in the treatment of the hyperthyroidism and it works by stopping the thyroid gland to make excessive amount of the thyroid hormones but not recommended for the children but used in only the adult. So next drug is methimazole. Methimazole, and this is the structure. And IUPAC name is 3-methyl imidazole 2-thione. So this is the structure of the imidazole. Means 5-member ring with 2 nitrogen is known as imidazole. In the second position, sulfur is thione. So thione, in third position methyl. So 3-methyl imidazole to thione. So this is a structure and impact mean. Properties are, it is a solid, faint characteristic odor, it is soluble in alcohol, chloroform and pyridine, but sparingly soluble in ether, petroleum ether, slightly soluble in benzene. Next, pharmacokinetics, it is oral route of administration and is rapidly metabolized by the liver using the cytochrome enzymes, and the several metabolites have been identified that are through the specific enzyme isoforms responsible to their formation are not entirely clear. So one of the first metabolite identified is 3-methyl thiohadantoin may contribute to the antithyroid activity. Its activity has been demonstrated in the rats and may explain prolonged duration of ionization inhibition of the following administration. And it's having a short half-life. The urinary excretion of unchanged form. So reported has been 7% and 12%. Elimination through the fecus appears in limited form. So it is the oral route of administration and it is rapidly metabolized in the liver by using the cytochrome enzyme. But also several enzymes are also be formed. So in that first one is 3-methyl thiohadantoin. So when we perform the experiment on the rat, what will happen is the prolongation duration of the inhibition of the ionization has been occurred, but there is a short half-life and it is excreted through the unchanged form of the unchanged form. This drug is excreted through the unchanged form. So adverse drug reactions are stomach upset, nausea, vomiting, skin rashes, headache, drowsiness, dizziness, muscle pain, joint or the nerve pain, swelling, hair loss. Uses, it is mainly used in the case of the hyperthyroidism in order to stop the thyroid gland to make the too much thyroid harm. So these are the drugs which has been used in the treatment of the thyroid and antithyroid drugs. And so these are the references books for the thyroid and antithyroid drugs topic. So these are the references books. Thank you.